Hi, Michael. My name is Briley. I'm going to be your student nurse today, and we're just going to go ahead and get started with your baseline assessment to start off our morning. I'm just going to hurry and close the curtain and the door for some privacy, and I'm going to do a quick safety check of the room. Looks like there's not any cords or tubes or anything that I can trip on. Looks like your bed rails are up, the wheels are locked, everything looks safe and we can proceed. I'm going to go ahead and do some hand hygiene. And can I just have you go ahead and identify your name and date of birth for me? And I'm just going to look at your bracelet you've got on here, okay? Your name is Michael Thompson, okay? I'm just going to go ahead and verify that with your bracelet. Can you tell me where we're at today? We're in the hospital, okay. Can you tell me what the date is? Yeah, it is January 28th, 2025. Can you tell me who the president is? That's right. Okay, everything lines up for identification on your bracelet, so we're all good there. And then can you tell me what brought you in here today? Just general weakness, tiredness? Okay, sounds good. I'm just gonna go ahead and grab a full set of vital signs on you. So I'm gonna grab your temperature, your blood pressure, your pulse and heart rate, and your respiratory rate, as well as your oxygen saturations. And it looks like you were on 2 liters of oxygen via a nasal cannula, and I'll go ahead and record my findings and then chart them later. Can you tell me how you're feeling today other than the tiredness? You seem a little bit groggy, but you seem like you're in a good mood, so that's good. Can you tell me a little bit, are you in pain today? Not really, just tired? Okay. In pain, I would assess Caldera. I would do characteristics of the pain, onset, location, duration, exacerbation, radiation, relief, and associated symptoms with his pain. But he does not have any pain today. So we're just going to go ahead and get started with your head to toe assessment. I'm going to start up here by your face, and I'm just going to feel for your facial structures, for any tenderness, maybe any broken structures, some swelling, anything, any abnormalities. Your bones feel great, and your glands are not inflamed. I'm just going to check your skin turgor while I'm here, and that looks great too. Everything looks and feels great on your head and neck, and I'm just going to go ahead and assess your pupils. Have you close your eyes. Okay, sounds great. And then I'm just gonna have you follow the tip of my pen. Okay, pupils are equal, round, reactive, and accommodating to light. Pupils are equal, round, reactive, and accommodating light and accommodation. I forgot to ask him for any past history or surgical procedures, and he stated that he did not have any. I would also ask for any medications he is currently on or any allergies. Are you on any medications right now? No, you're not? Okay. Are you allergic to any medications? You are allergic to penicillin. That is great information, and we'll make sure we are aware of that. Now I'm going to move on to your chest, and I'm just going to go ahead and inspect the skin on your chest. I'm just going to pull your gown down a little bit. Okay, your skin looks great. It looks the right color. It's intact. There are no lesions, bruises, any masses or abnormalities. Do you have any chest pain? No, you don't have any chest pain? Okay, I'm just going to go ahead and listen to your heart in 5 different spots. This is aortic, this is pulmonic, and then Erb's point, tricuspid, and then the mitral valve, where I would listen for 1 minute for the PMI, rate and rhythm. Okay, after 1 minute, everything sounds good, heart sounds are all normal. And have you had any shortness of breath, tightness in your chest, congestion, cough, anything like that? No, you haven't? Okay. I'm just going to watch your chest for your rate and and your effort of breathing. And everything looks normal, so I'm just gonna go ahead and listen to your lungs. I'm gonna sit you up a little bit though. Make it more comfortable for you and I. Okay, and when I listen to your lungs, I'm gonna listen in 6 spots on the front and the back, just so I can reach all regions of your lungs. Okay. All right. I'm just gonna mind your core here. And I'm just gonna come up under your gown on this side. And same over here. I'm just gonna reach around. Listen to your lower lobes. Okay. Anterior lung sounds are clear. And I'm gonna help you sit up just a little bit, and I'm gonna listen to your anterior lung sounds. And I'm just gonna go ahead and inspect your skin on your back while I'm here, and everything looks great. There are no abnormalities, bruises, wounds, anything like that. I'm gonna go ahead and give it a listen. Once again, 6 spots. And this is the upper lobes, the middle lobe, just lining the shoulder blades, and then the lower lobes. Okay. Breath sounds are clear, anterior as well. All right, I'm gonna help you sit back. Okay. All right, now we're gonna lay back down. The next thing I'm gonna do is I'm just gonna move on to your abdomen. I'm gonna pull your gown up. Once I get you laid down, I'm gonna pull up your gown. I'm gonna keep you covered. I'm gonna pull your gown up, and I'm just gonna inspect the skin on your stomach. There's no bruising, swelling, distension, any masses or abnormalities that I can visually see. Now I'm just gonna listen to your bowel sounds in all 4 quadrants. And listen for about 5 to 30 seconds in each quadrant. Okay, everything sounds great. We have normal bowel sounds in all 4 quadrants. And now I'm just gonna palpate your abdomen in every quadrant again, and you just let me know if you have any pain, okay? Any pain with that? No? Okay. And then, Michael, can you tell me a little bit about your bowel habits? Have you had a bowel movement today? No? When was your last bowel movement? Last night, okay. And then do you have pretty regular bowel movements? Yeah? Okay. And then how about your urine habits? Are you able to empty your bladder fully? Do you have any pain, burning, discoloration when you urinate? No? Okay, that sounds great. The next thing that I'm gonna do is I am going to just look at your hands here. I'm just gonna take both of them at the same time, and I am just gonna check your pulses. And your pulses are equal and bilateral, which is great. I would say 2+. I'm gonna check for your capillary refill on both sides. Equal bilateral, less than 3 seconds, which is great. And then I'm just gonna feel each arm for any edema, any atrophy, I'm just gonna inspect the skin for any bruises, wounds, anything like that. Just general check on them. Everything feels and looks good with your arms. And then can I just have you squeeze my fingers really tight, as tight as you can? Good, nice and strong, both sides, equal bilateral. Okay, I'm gonna move down to your feet, and I'm gonna do the same thing. I'm just gonna check your pulses on the top of your feet, which are equal and bilateral. And I'm gonna check your capillary refill. Same thing there, equal bilateral, less than 3 seconds. And can I have you push on my feet like gas pedals? Good, and then push my hands back toward, pull your feet back towards your face, push my hands. Perfect. You are nice and strong. Now I'm just gonna inspect your legs really quick, just for the same thing I did up with your arms. Edema, lesions, bruising, atrophy, any abnormalities really. Okay, it's clear there. And on this side. Okay, and everything looks good on this leg as well. And I did notice earlier that you do have a catheter. I'm just going to go ahead and check that really quick. It doesn't look like it's kinked anywhere. The site looks fine. Everything looks and feels great with all of your extremities. Okay, and the last thing I'm going to do is I've already checked all of your skin as I went along. And you did not have any wounds or drains or anything that needed to be looked at this time. Everything looked great. You do have the one catheter, which looks fine. You are on oxygen, which your tube is not kinked or anything. It's still running at 2 liters. It looks like it's sitting okay. Your nares look great. And then you do have a port, and your port site looks great. The dressing looks fine. It does not need to be changed. There's no redness or irritation to the skin. And there are no other cords, drains, tubes, anything. I'm just gonna go ahead and leave you with your call lights. And I'm gonna put your bed back down. And then normally I would have you hop up to do some gait assessments. But where is the mannequin? We're not going to do that. Michael, do you have any questions for me? Anything that I can do for you? No? Okay, your bed rails are all set. You've got your call light. And you go ahead and call me if you need me. I'm just going to take off my gloves, perform some hand hygiene, and then I am going to go document all of my findings.